In Florida, there's two types of models of treatment when it comes to residential and partial. There's the Florida model, and then there's the Beachcomber model. The Florida model is a model where the patient's living quarters is separate from where the therapy takes place. The Florida model also, the patients are responsible for their own shopping and cooking of their meals. The Florida model also, the therapists generally work a 9 to 5, in that in the Florida model, patients are assigned to one therapist, where the Beachcomber model is that everything's on the same property. We do all the cooking. We do not assign a patient one therapist. Patients that come in here are assigned to all the therapists, and we're only staffed by therapists. So at any time any patient has a need, we're able to meet it because there's a therapist on from 8:30 in the morning to 10 o'clock every night. And we maintain our program 7 days a week. About 2009, we started noticing that we were getting a different type of clientele, and a lot of it's due to the increased addiction to the opiates and to the benzos. And when I mean opiates, I mean heroin, Oxycontin, Roxycontin, and benzos is mainly Xanax. And we noticed that coming into the first week, we were seeing a lot of anxiety, a lot of struggles with what appeared to be still showing some what we call post-acute withdrawal. So at that time, we started to bring in what we called holistic therapy. And so we brought in yoga, acupuncture, we brought in a therapy called light sound therapy, we brought in the boxing, and we also began to look at our nutritional part of our program. And what we've noticed that a big change in the patients in adjusting to the treatment early on. We're seeing less people wanting to leave. We're seeing a lot less anxiety. So we're really starting to see that, implementing traditional therapy with the holistic therapy has had a real positive approach and does support, the concept of Beachcomber, which is, we treat the whole person, not just the addiction. Also, other services that we provide that we believe has had a very positive impact on the Beachcomber and the treatment is the family program. This is a family disease. A lot of programs will focus just on the person afflicted with the illness and not on what we call the innocent people, which is the family, because it has a very negative impact. And that we find that in order to have success at recovery is that the family also has to be educated on addiction. They also have to be educated on the aftercare and, why, we are recommending or certain changes that we're asking them to make. They need to understand why we're recommending or asking those things. Sometimes the most work is done with the patients with the patients. Part of the Beachcomber, we don't have TVs, we don't have cell phones. And the reason we don't do that is because it makes them have to socialize. It makes them have to learn how to communicate, without having to talk about the drugs or the alcohol. It makes them have to get to know other people. We find that the biggest distractions out there can be is TV and phones. So we really try to take away all distractions it's going to support or help motivate the important piece, which is forming healthy relationships, learning how to socialize in a healthy way.